all of you to day 2 of Practical Diabetology, session 2, which is balancing the old and new, a 360-degree views on type 2 therapies. For today's first talk, we have Metformin and its magic with Dr. Ketan Joshi. Sir is MD Medicine, consultant physician, diabetologist, practicing in Visnagar since last 28 years. He is past president Epicon Gujarat chapter and he is a trusted leader and mentor in medical community. I welcome you, sir.
Thank you. Thank you for inviting me, Vipul, Dhruvi and all organizer. I am Dr. Ketan Joshi and I have done wonderful work on type 1 also. We have adopted 143 children for type 1 and we have made them insulin free and all these complication free since last 4 to 5 years. Then we have planned for more and we have passed the budget of 13 crores in our Gujarat assembly for type 1 children's. And now we are communicating with Nadda Sahib and all for all this management type in Ma card for type 1 children. So we are this is my another, this is not my, I am not pediatrician, even though we are trying for type 1 children. Thank you. And this is the day we are discussing about metformin. Now diabetes is so common. Even who gana patient ne kahu chu, gana first time detected, they are scaring. So we have don't scare. Then diabetes and hypertension is so common. So you have mentioned in your Aadhaar card. So come with diabetes and hypertension, because already 50% population of our Indian are suffering from diabetes and hypertension. So these are very common. So our aim is to prevent as early as and prevent the complication of diabetes. And our population is not so rich. They are middle class and all this. So the metformin is a drug. It's a magic drug. So it helps for pre-diabetic. And pre-diabetic is about 10 crores people from India are pre-diabetic. So we should early detect them in pre-diabetic. And pre-diabetic, if we detect in pre-diabetic, so we can delay 10 to 15 years in diabetes and its complication. So our health communication burden will be delayed. And we are also somehow relaxed, because due to diabetes there is a plenty of diabetic retinopathy in our setup. Diabetic retinopathy, nephropathy, neuropathy, all complications are coming, and they are poor people from periphery, so they don't know how to manage. So we should detect pre-diabetic and treat them accordingly and understand them the complication of diabetes. Metformin. This metformin is a 60 years old drug. It is get from plant and it is always first line of this troop in medicine from diabetes. This metformin treatment in type 2, we all know this basic these things. It is increase insulin suppression and analogs glucose production, glucose uptake and utilization of peripheral tissue such as skeletal muscle and adipose tissue. It decreases hepatic glucose production through suppression of gluconeogenesis and intestinal glucose absorption. This is a basic thing in diabetes. Metformin include all stages of diabetes. This beyond. This is very helpful in pre-diabetic. From HbA1c 6 to 6.5, they are pre-diabetic, and all obesity, family history, and those are recurrent blood sugar altered. We should consider them pre-diabetic, and we should treat with starting dose of metformin sustained release. If they are not tolerating, then we should consider another exercise and all this. We should advise according to. It is also helpful for type 2 diabetes. We all know diabetes complication. It is also help for diabetes complication. Except end-stage renal disease, it is very helpful drug. Beyond type 2, it is also beyond type 2. Diabetes, metformin. I have noticed in corona, I have treated 17,000 patients of corona, and my personal experience of those patients on metformin, they are likely to less complication in corona. So it is very helpful drug in corona. This is my personal, you all also senior physician, Rana Saibor. So those who are on metformin, so they have likely less complication, less hospitalization, and less complication in diabetes with metformin. So this is wonder drug. China is also use metformin, very common for diabetes. And beyond, this is also helpful for cancer and pregnancy, gestational pregnancy, PCOD, and it is also for helpful in another beyond this situation. This today's diabetes management around the theme of early action, role of metformin start for pre-diabetic phase, prevents the late delay and onset of diabetes in patient considered to be high risk in the disease, significant reduced incidence of diabetes as per principal diabetic prevention trial. Prevention delays diabetes and associated comorbidities. Standard care in diabetes 2025. Pharmacogenic interviews. Metformin is a prevention of type 2 diabetes, considered adult and high risk type 2 diabetes, typically by DDP and especially age of 15 to 59 years with more than body mass index is 35. And higher, fasting plasma glucose more than 110, and HbA1c more than 6, individual prior gestational diabetes history. Metformin first oral treatment to be approved in India as a pre-diabetic. This is a very cheap drug. We should only if it produces side effect. The gastritis, nausea, vomiting, we should start from 250 sustained release to 500, 1,000, 2,000, maximum we can give 2,500 milligram. And another side effect, lactic acidosis, we should also check for this. This is the anti-hyperglycemic effect of metformin increase with increasing daily doses. So this is a chart typical. We should gradually increase the metformin dose, and with the dose dependent, it affect gradually, and we should check every 3 monthly, and it is very wonderful result in pre-diabetic and early diabetic. We should accommodate with lifestyle modification and dietary changes, so we can delay all the other complication. This is the interpretation of metformin therapy with a dose range, presented rational and practical therapeutic strategy for optimizing glycemic control in patient which suitable for tolerance of all metformin treatment. This is a daily dose of metformin. We should start from 250, 500, 1,500 up to 3. And this fasting plasma glucose. Second chart is dose of metformin and postprandial blood glucose. Both we are dating positive. Metformin today another uses. This is metformin in a special population. Metformin in women health. It is, we all know, it is helpful in gestational diabetes and PCOS. This is in pregnancy. Metformin in metabolic disorder. It is also helpful for obesity. It reduced 2 to 3 kg weight loss in most common were started within 6 months. And dyslipidemia. It is also helpful for a patient with dyslipidemia. And patient with the very common another condition, this NASH, non-alcoholic cirrhosis. It is more common than alcoholic cirrhosis. Metformin is a very wonderful drug with vitamin E and saraglitazole. It is very helpful for this vitamin E, saraglitazole and metformin combination for early cirrhosis and early liver parenchyma altered. So it results very good. And metformin in tuberculosis. In MDR COX, we are the hub of tuberculosis. In MDR COX, patient on insulin, we should add the metformin. It will help this inflammatory process and resistance of MDR. Then metformin in cancer. So it is also proved that with chemotherapy, patient on cancer, this tissue this INF and malignant cell prevention, malignant cell neogenesis is decreased. Metformin in aging metabolic morbidity. Metformin is also help to prevent age. If you want to be young, then the start metformin, it will help 5 to 6 years to be younger. Metformin in cardiovascular benefits. This is a cardiovascular, it is a plant-based drug. Cardiovascular benefit of metformin: lower blood glucose, endothelium protection, antioxidant action, inflammatory reduction, leukocyte adhesion, blood pressure reduction, and micro and macrovascular complication. It decrease. It also help for brain, civic and inflammatory process. It also for adipose tissue. It also help in liver. It also in gut. It also in kidney. Up to 30 GFR. It will beneficial effect. In third and fourth end stage renal disease, we should omit metformin because there is chances of more complication. This is end stage renal disease. Early intervention blood glucose control with metformin lead to 31 fewer heart attack and 25% fewer death. Safe use of metformin in CKD up to 30 GFR. Early stage, 1-2 stage, metformin is safe and you can use with insulin and other oral hypoglycemic agents. Long-term effect of metformin on patient with type 2 diabetes and kidney disease. This is very good, but we should not use in third and fourth stage. This is the all chart showing all cause mortality in total group of patient and end stage progression with total patients. Anti-aging effect. This is in ADA, I have gone in USA, they are also accepted. The anti-aging effect of metformin is very wonderful. If you take, there is all cell maturity is decreasing. So we should start in low dose, 500 sustained release. After 50, it is very helpful. Metformin anti-aging agent. Low micro concentration, 50 micro of metformin also protect endothelial cell against high glucose induced sensation. Inhibit the MTRO sliding and with help for their gluconeogenesis. Reduce the inflammatory cytokines activity in sensitized cells and also cancer stem cells by blocking NF, KB and cytokines expression pathway. Clinical trial studying effect of metabolic on human aging. This is a very good trial done in USA, UK and Australia. This is a positive trial and p-value is also positive. So if there is no complication and no side effect, we should start with patient with obesity, pre-diabetic, low dose metformin is the best. Metformin as a fountain of young. So this is a chart showing with exercise, diet and metformin, you can keep young and delay the death. One person said this is one type of Sanjeevani. Metformin in cancer. Metformin is also helpful to direct effect and indirect effect. Indirect effect by insulin. Insulin on glucose level, insulin on liver, brain, gut and muscle. So insulin sensitivity is increased and insulin resistance is decreased. So hyperglycemia is decreased and cancer cell will grow more in hyperglycemia. And direct effect, this chart we show, AMPK and anti-tumoral activity of metformin is very good. And tumorigenesis is also decreased. So we can, cancer cell we can use with chemotherapy. All these cycles show immune cell, DNA damage, cell circle arrest, EMT transition, glucose metabolism, cell growth and proliferation, angiogenesis, all in stage, metformin will help. Process mechanism action of metformin, anti-cancer effect. It is preventing hyperinsulinemia, inhibit cancer cell growth, downgrading of HERE2 expression and phosphorylation, downgrading of cyclin D1 and E2F expression, inhibiting MAKT and M-tyro activity, activating MAPK, which is associated with mTOR inhibition. This all are cellular level. Clinical trial with metformin and other chemotherapeutic agent. In breast cancer with liver, lung, metastasis, colorectal cancer, prostate cancer, pancreatic cancer, and chronic lymphocytic leukemia, breast cancer, with all chemotherapeutic agent, metformin give wonderful results. Metformin in women's health. We know all, this is very common in PCOS. This is mild to anti-androgen effect of reduced risk of miscarriage, second line devolution, induced agents, decreased OH/SS with IVF, and gestational diabetes mellitus, reduced weight, safety of and efficacy compared to insulin, reduced risk of miscarriage, decrease the neonatal hypoglycemia. Metformin act in early and all stage of HPCOS by improving IR, PCOS, insulin resistance. It act on insulin resistance. We show this all theory, and it act on ovulation, irregulation menstrues, and it also help for IVF during pregnancy, metabolic dysfunction, all stage it is helpful. Then this MIG trial also proved that pregnancy and all, it is helpful, very helpful. This is TIMI trial in 2002. It is also done in Canada and Australia. Metformin with placebo. So this is positive that metformin has served maternal glycemic and neonatal adiposity benefit. This is recommendation endocrinology and metabolic talk. Metformin in obesity. We all know metformin reduced the insulin sensitivity and resistance. Diet also, it is also help for diet control and 2 to 3 kg weight loss in patient within 6 to 8 months. And how metformin work in obesity? It work on in leptin and leptin resistance. Metformin may enhance leptin sensitivity and reduce leptin secretion. That result in decreased expression of neopeptide causing hunger and increased feeling of satiety leading to appetite suppression and decreased food intake. I have also marked very more patient after metformin starting, their food intake is decreased. Glycemic control and neonatal outcome in women with gestational diabetes mellitus treated all this material and positive results. Diabetic prevention program. This is very helpful for diabetic prevention program. This is a subjective and percentage wise. It proved its efficacy. Diabetes prevention program study 10-year follow-up. Metformin in dyslipidemia. Metformin lowering mechanism of in lipid alteration. This metabolism type 2 diabetes through several pathways. Increase insulin sensitivity, reduce rate of lipolysis, slow the conversion of pre-fatty acid to lipoprotein, and improve the dyslipidemia by inducing weight loss and patient with impaired glucose metabolism. This is the slide also saying helpful for this lipid alteration and dyslipidemia. Metformin in this is also common non-alcoholic cirrhosis. It is help for reduce blood glucose level, improve insulin sensitivity. Metformin promote weight loss, lipid parameters benefit, and long-term data shows safety and tolerability. It should help with vitamin E and saroglitazole in weight reduction. Metformin in the treatment of non-alcoholic fatty disease, safety, efficacy, and mechanism. Metformin, pioglitazone, statin, and vitamin E. And another is saroglitazole. These 5 drugs help wonderful. And if there is a PK score is less than 15, it reduces this fibrosis of liver. Growing evidence of metformin in COVID. We have already talked, patient with COVID, we have very beneficial effect, and we have proved that in COVID complication it is also helpful. Maybe due to hyperglycemia, it reduces hyperglycemia and insulin resistance. Metformin all around disease spectrum. Metformin in tuberculosis. It is also help for tuberculosis in inflammatory process, cavitatory process, and another. It help for to convert in MDR COX to normal COX to MDR COX. It prevent. This is a graph. Safety. In general, we should, if there is a no complication, pre-diabetic, diabetic, we are all starting metformin in early stage, and it is very wonderful drug. Thank you.
Absolutely.